Hello. What's up, everybody? Dr. Rafich here. Good morning from Vet Triage. It's 9:31 a.m. Pacific Time, July 27th, and we'll talk about some blood in the stool. Thanks to those who watch in the playback. Thanks to those who donate and subscribe and hit like. It's all appreciated. We are getting more consistent audience members now, which is nice. That's good. It's very cool. All right, so bloody stool, bloody diarrhea. We're going to focus on the bloody part because it's a very common concern with pet owners. And right off the bat, I'm going to say that something like this really needs a veterinarian involvement, and vet triage is great for it, 24/7. We can help determine whether or not it's truly an emergency, and in the event that it's not an emergency, you'll feel better, you'll get peace of mind as a pet owner, and then we can give you some advice for what to do. Advice should be specific to the pet, and so that requires a veterinarian's investigation of your situation with your pet. But okay, having said that, bloody stool or blood in the diarrhea is not always a medical emergency. It depends. What causes the blood in the stool is irritation of the large intestines. Large intestines are made up of the colon and the rectum. More specifically with the colon, ascending, transverse, and descending colon, and then the rectum. You could theoretically also have bloody stool if there's any irritation or lesions involving the anal sphincter, the anal glands, maybe even the perineal region. But ultimately, most of us are thinking about it in terms of something happening internally, and that would usually imply colon or rectum. There are many, many causes, probably beyond what we can go over on this live stream, for why a patient would even have irritation or inflammation of the large intestinal tract. But we can at least talk about it in more general terms. Infection, any kind of bacterial imbalance, let's say, for example, which is also called dysbiosis. And that can cause a colitis, which is inflammation of the colon. You could be afflicted with large intestinal neoplasia, so cancer can do it. Ones like adenocarcinoma, for example, lymphoma. There are others, mast cell tumor. And then anything that causes inflammation in general. It doesn't have to be inflammation caused by infection or cancer, although it can be inflammation caused by stress, for example. And in fact, it's so common, we call that stress colitis. That can cause irritation, inflammation of the large intestinal tract. So those are some broad ways to think about it. There is another category that's independent of the large intestinal tract, and that would be anything else in the body causing a bleeding disorder. So any coagulopathy, which is an abnormality in the coagulation pathways, which are the pathways in the body that allow for the body to form clots whenever there's a cut. If you cut your skin, you don't bleed to death, right? Because your body forms a clot to stop the bleeding. So if you have an abnormality with your bleeding pathways, with your coagulation pathways, then you are prone to having bleeding, and colon rectum could be one such area. But the difference being that typically, if you have a coagulopathy, you'll have signs of abnormal bleeding parameters on other parts of the body, not just with the feces. But just to make sure it's and I'm sure there are other reasons for it. Shock gut, for example, is another reason for inflammation. Shock gut, shock, SHOCK, gut, is specific to dogs, but any species that is undergoing shock can get this, and it implies a decrease in cardiovascular perfusion to the colon because of shock, and because of that, the colon loses its blood supply, and from there becomes inflamed, and then can have bloody stools or bloody diarrhea. The reason why blood flow is impaired to the colon, rectum, is because during shock, the body has to redistribute the cardiovascular perfusion percentage to more vital organs. So, for example, your legs, you have to run away from that danger, or has to perfuse more to your lungs so you can have larger tidal volume and be able to escape. Hey, audience member, thanks for joining. Any questions, let me know. So shock is a systemic problem, a problem of the entire body. Dogs specifically, their gastrointestinal tract is considered a shock organ. A shock organ is an organ in the body that is more sensitive to the effects of being in shock. So it's just something unique to dogs, but any species can have shock gut. But just another example. Anyway, so as far as what to do about it, depends on what the veterinarian says, what they think. Of course, we're not going to go into too many specifics here because it needs to be tailored to your pet's situation. But some common interventions for dogs or cats with bloody stool, bloody diarrhea are things like probiotics to help rebalance the bacterial tract in case what we think is going on is a dysbiosis scenario. Anti-diarrhea medications, antibacterial medications, anti-parasitic medications, depending on the cause of the diarrhea, are also commonly used, usually prescription-based, not always though. Changing the diet to something a bit more bland so the gastrointestinal tract has an easier time digesting it. So you want to avoid, in my opinion, you want to avoid things that are like fibrous, so pumpkin, and you want to avoid things that are bulking, like bulking agents or diets that intend on bulking the stools. You really want minimal residue to try and calm down the large intestine. But again, that's not true for every single case. It depends on the details of your pet's condition. Something like frequent walks can help with intestinal motility, get things flowing, get things out of the system. That's also helpful. So you'd walk your dog every couple hours, maybe 10 minutes at a time. Obviously, not every dog can do that. Some dogs are paralyzed. Some dogs have really bad arthritis. Some people live on in a high story, and so you have to take stairs or elevators constantly, go outside. Sometimes it's snowing or raining out, etc. But yeah, so those are just some of the ways to handle it. The coagulopathy part of it is a bit more tricky, and that's beyond the scope of this live stream, because that's just not treating the bloody stool. That's a bigger problem than just something in the colon. And the same thing goes for shock gut and any other systemic disease that's causing bloody diarrhea or bloody stool. You need to treat the primary condition. You will also treat symptomatically the bloody stool and diarrhea, but your main focus as the veterinarian in those cases is to find out the primary cause and then treat that. Okay. And so lastly, if you're noticing your dog seems constipated from this type of condition, so he or she is going, and the poop's getting less and less and less, and finally nothing's coming out. It's not that your dog has, usually it's not a dog that has blockage. It's not a dog that is now constipated. They're just empty. And when there's colitis of any reason, that agitation, that irritation, that impulse to keep pooping, there's something in there, is part of what is caused by that inflammation. So anybody who's watching or listening to this, if you've ever had a urinary tract infection or known somebody who's had a urinary tract infection, that inflammation of the urinary tract causes the patient to feel like they have to pee all the time, right? It's irritating. And it's the same thing with the large intestine. If there's inflammation, if there's colitis there, they'll feel like they have to poop all the time. It's very annoying. And it can be very painful, depending on the case. But that's one way of thinking about that. And that's one way to look at it, and so you don't freak out. But again, you could have a blockage. You could have something more serious going on if they're straining to poop. It's just a matter of talking to the veterinarian and figuring it out from there. But I just want to let you guys know it's not surprising. Yeah, and I would say that's probably it. Hopefully this video helped. Thanks for those watching on the playback. Thanks for our one audience member who joined briefly today. And hopefully we'll get more audience members. If there's any topics you guys want me to discuss, leave me comments, send me a message, whatever it is. Yeah, and let me know how things are going. Again, vettriage.com. We do have vettriage.com/ESP, which is for Spanish-speaking pet owners. We have vettriage.com/horse for those who own horses. And then soon we will have Vet Triage Pro, which will allow for newer graduates, vet students, to have mentorship available to them to deal with real cases that they're managing right there at the moment. So it's very exciting stuff. We're very excited by that, and more news to come on that in future videos. Thanks to everybody again for watching and listening, and we'll see you in the next one. Take care.